Okay, so we're recording. If anybody has questions as we're going, feel free to unmute and jump in, or if you want to send a message into the chat box, I can answer that as we go, and we'll have some time for questions at the end as well. But let me bring my presentation up and we'll get started. Alrighty. Can everybody see this? No?
No.
How about now? Nope, still no.
Oh, something's happening.
Yeah.
There it is.
Okay, so you can see my Google Doc here. All right. All good? Okay. All right, so what we're going to be talking about today is building your balance house. And by this, I mean trying to build up both your physical health and your neuromuscular system, your balance, to prevent you from falls and hopefully from injury as well. So why is it so important to prevent falls? What the statistics show is that 1 in 4 over the age of 65 fall each year. Less than half of those people tell their doctor, so a lot of these are going undocumented. But what the unfortunate side of this is that falling once can actually double your risk of falling again. So after one fall, you are more likely to fall again in the future. Falling is a big deal. It's not just a slip and fall and get up and get moving. It actually has a lot of sort of worrisome outcomes that can go along with it. So 1 in 5 of falls results in serious injury, including fractures and head injury. Falls are the leading cause of traumatic brain injury and hip fracture. And the scary thing with hip fracture is that 50% of those who have a hip fracture from a fall are discharged to a nursing home or a nursing facility rather than their own home. So in terms of quality of life and independence, it can have a fairly substantial effect. And then sort of moving back to how I mentioned that falling once doubles your chances of falling again, it falls into this sort of vicious cycle that I've talked with several of my patients about, how a fall occurs. After the fall, you're shaken up. Hopefully you weren't injured. If you were, then you're worked up, get back on your feet. And afterwards, your fear of falling increases. So with that increased fear of falling, people tend to do less. They reduce their activity. Maybe they leave the house less, or they stopped doing normal activities that they normally would, like regular walks in the neighborhood, going to the grocery store, just going out to meet friends because they're concerned about falling. With this reduced activity, our body responds to the amount of load that they're exposed to. So if you're exercising daily, if you're moving daily, your body is going to be sort of primed and ready to do those things. If you're not, if you are doing less, your body is going to, for efficiency's sake, essentially decrease your muscle mass, decrease your total strength capacity, and your endurance is going to decrease as well because you're not working your heart and lungs in the way that they were previously. So this weakness and decreased endurance can result from the reduced activity, which then puts you at a higher risk of falling again, and the cycle continues from there. Trying to interrupt this cycle can be so critical for people to maintain their quality of life and longevity so that they can do the things that they want to do independently for as long as they possibly can. So in order to start addressing building our balance house and knowing what the key components are here, it's important to know how our bodies maintain balance. So I'm going to blow up this picture here so we can see it a little better. It looks like it's a little fuzzy. I apologize for that, but I'll talk through the key points here. So our bodies use 3 main systems to maintain our balance and posture while standing upright and moving around. The first one is our vision and our eyesight. The second is our auditory system, or our inner ear, which comprises our vestibular system. Our vestibular system's main role is to detect where our body is in space, where our head and eyes are in space, and the coordination between those two things. So picture yourself walking down the sidewalk while looking left to right, maybe looking at signs, maybe looking at where you need to hit the next crosswalk. Our body needs to be able to know that our legs are still moving forward while our head is turned to the side without losing balance or changing our trajectory. So that's a really big part of our vestibular system, as well as the ability to coordinate the movement of our head and eyes, because oftentimes, I'll sort of demonstrate here, our head can go to the side, but our eyes are staying on the same target. So your head is moving to the left, or maybe on your screen's the right, while your eyes are moving in the opposite direction. And our vestibular system, our inner ear, plays a very big role in that, which consequently plays a really big role in our balance when upright and moving. The third system that helps our body maintain balance and upright posture is our somatosensory system. And this is comprised of our joint position sensors in our arms and legs, and something called proprioception, which is our nerves that help communicate to our brain where our body is in space. So this is how, without looking down, you know that your right leg is maybe off to the side, or maybe it's rotated. You can feel where your legs are without actually having to look at them for most people in most cases. And this is part of your somatosensory system. So these three systems, your vision, your inner ear vestibular system, and your somatosensory system, all give input to your brain. And with all of those pieces from each of those domains, your brain is able to have a pretty good idea of where your body is in space, where your center of mass is, and how to keep you upright without you losing your balance. So the interplay between those three systems is really important for a couple aspects of how our body maintains balance. First of them is static balance. So static balance is the ability to stand still or maintain a position without losing your balance. So that sounds pretty simple, like just standing still. Maybe you're in line at the grocery store, but picture if you are maybe standing on a ramp, or standing on an incline, or standing on loose gravel or squishy grass. Your body has to be able to maintain your balance and your positioning with those new changing elements, and be able to respond to any changes in the environment related to that. Next layer of balance is your dynamic balance. And this is the ability of your body to maintain its upright posture and positioning when you're up and moving around. So think of walking, going up and down stairs, getting in and out of bed, or up and down from a chair. These are all complex movements that, while our body is moving, our brain is making small adjustments almost at a constant level to keep you upright and to keep you from losing your balance. Third level is something called reactive balance. So this is going to be the type of things that maybe your body can't sense until it's already happened. So somebody bumps into you at the mall and runs into your shoulder, or your foot slides out from under you on a slippery sidewalk. Those are elements of reactive balance, where something happens to you that your body then has to respond to in order to maintain your positioning. And just overall, you put all of these things together, these three systems, your eyes, your inner ear, and your somatosensory system, work together to keep you doing the things that you want to do and keep you out and about moving the way that you'd like to. I'm going to make this a little bit smaller and then working down here. So now that we have a better idea of how our balance system works, how our balance house is built, how do we know if we're at risk of falls? So the one thing that I'll preface with is that falls are multifactorial. There's no one cut and dry answer to whether someone will or will not fall, but there are certainly factors that can increase the risk that you have. And the more risk factors that you have, the higher your risk of falling could be. So working into risk factors first, general lower body weakness. So in order to stay upright and to be able to respond to changes in your environment or respond to different body positionings, you need to have the strength to be able to maintain those positions. So maintaining good strength of your lower body is one of the biggest risk factors related to falling. Vitamin D deficiency is another one. Vitamin D deficiency is closely related to osteopenia and osteoporosis, which also carries its own risk of falls, because your bone density isn't what it once was. It's not able to maintain the weight of your body as efficiently, so people tend to move less and sort of fall into that vicious cycle that we talked about earlier. Certain medications also carry a risk factor for falling, and a lot of these are probably medications that you're familiar with or might be taking yourself. So sedatives, antidepressants, blood pressure medications, anticoagulants, or commonly known as blood thinners, opioids, and certain pain medications can all have effects on our nervous system that essentially dampens sort of the level that our nervous system is working at, and makes it less responsive to changes in the environment and increases fall risk. Low vision is another one, and this one ties directly into our 3 elements of maintaining balance that we talked before. So if you eliminate one of those elements, such as vision, the other 2 elements are going to have to work quite a bit harder to communicate to your brain where you are in space. Essentially, if you're not getting full vision to your brain, it's not getting the full picture of where you are in space and has to rely pretty heavily on the other systems. Next up, so along those same lines, numbness or loss of sensation in your feet. So if you have any conditions such as diabetic neuropathy or just any generalized neuropathy or changes in sensation in your feet, that third somatosensory system isn't going to be giving your brain as much input as to where your legs and lower body are in space. So it can be quite difficult for your brain to then rely on just your vision and inner ear to coordinate your positioning. Along the same lines, foot pain and poor footwear can have an effect on that. Foot pain alters the sensation in your feet, so you're not sending as good of a sort of message to your brain of where you are in space. And then poor footwear can just put you in a position that increase your fall risk. So really bendy flip-flops that fold under your foot, or something that doesn't have a good tough tread on the bottom and is very slippery, can increase more of your environmental hazard to falling. And that takes us right into environmental hazards around the house that can also increase fall risks, such as throw rugs that can be tripped on, clutter in the home for the same reason, and uneven steps or flooring that can work as tripping hazards. So it's a pretty lengthy list, but the really good news is that for many of these factors, they're modifiable. So lower body weakness, that's something that can be addressed. Maybe it's via exercise, or maybe you have a certain type of condition that predisposes you to weakness that maybe just requires more medical management to address. Low vision, going to see your eye doctor, your ophthalmologist or optician, and making sure that your prescription is up to the level that it needs to be. And then definitely like the footwear and environmental hazards are all things that can just be addressed on sort of a case-by-case level, trying to eliminate the number of factors that could be playing into your fall risk. Some of the less modifiable factors fall under medical conditions. So COPD, or chronic obstructive pulmonary disease, decreases your overall sort of lung capacity, which decreases your endurance, and therefore you can become more tired with less activity and become prone to falls by essentially being overexerted. Vascular disease works in a similar way, where if you have atherosclerosis or any sort of cardiac or blood vessel diseases, if you're not getting adequate blood flow to your muscles, they can't respond to changes in your environment as quickly. Diabetes is another one that can have a really big effect on your vision, numbness in the legs, and just overall sort of tolerance to activity, as well as some neurologic conditions such as Parkinson's disease and multiple sclerosis are 2 conditions that have a higher fall risk. Another one that I'll sort of toss in here as well is any dysfunction of the inner ear. So if you've heard of somebody having positional vertigo, vestibulopathy, Meniere's disease, there's a lot of different names that go with conditions of the inner ear that can make people feel very dizzy and nauseous. Those are medical conditions that can clearly increase your fall risk because you're feeling dizzy. A lot of those respond really well to either medication treatment or physical therapy, but not all of these medical conditions that I just listed can essentially be completely eliminated by medication alone. However, there is a lot of really good evidence out there, especially in the last couple of years, that many of these more long-term medical conditions can respond really well to physical therapy and regular exercise to help manage the overall condition. So I'm going to pause there for a second and just check in to see if anybody has any questions, anything that I did not make clear at this point. So we'll just pause and see if anybody has anything. Okay, so jumping back in here. Let me just double check. Okay. So we talked about some of the risk factors that can clue you in on whether or not you are at risk for falling. So maybe in your mind, you've started to compile a list of what applies to you, or maybe what doesn't apply to you, and improves your balance in your overall balance house. Past this, we can also do some objective testing that can give you more of a concrete look at how your body is actually functioning in terms of those three balance systems: your vision, your inner ear, and the sensation in your feet. So I'm sharing two tests with you today that can be done fairly easily from at home. The one thing that I want to say as a disclaimer is that for any of these tests, if it's something that you do not feel safe doing or not comfortable doing, then please don't do it. As well as if it's something that you are interested in but don't quite feel comfortable testing for yourself, I recommend reaching out to either your primary care doctor or a physical therapist to maybe talk you through how you could how it can be tested for you in a safe manner. However, I tried to pick two today that are fairly easy to do at home without much setup. But I generally advise people set yourself up either in a corner, by a countertop, or something that you can hold on to so that if you do start to lose your balance while going through this test, you're able to use your hands to steady yourself. So the first test here is the 4-stage balance test. So you're going to begin standing either in a corner or by a countertop, and you're going to bring your feet so that they are touching side by side, so flush together. And you're going to try to maintain this position without using your hands on the countertop. So either keeping your arms at your side or across your chest, and trying to maintain this position for at least 10 seconds. If you start to lose your balance, or if you do lose your balance within 10 seconds, then that's where the test stops. You don't go on to the next level. If you are able to make it for 10 seconds without losing your balance, then you move on to level 2. So level 2 is going to be a half tandem position where you have one foot halfway in front of the other. And you're going to do this with both feet, so both your right foot in front and your left foot in front. You're trying to maintain this position again for 10 seconds without having to put your hand down or lose your balance. If you're able to make it past this level, you go to level 3, which is a full tandem stand, and this is sort of like your tightrope walk, one foot fully in front of the other, and trying to maintain that position for 10 seconds. Same as the last one, you're going to do this one in both positions with your left foot and your right foot in front. And then level 4, if you've made it that far already and don't have any losses of balance or need to use your hands, then try standing on one foot on each foot. So per the CDC, which this test comes from the Centers for Disease Control and their fall education programming, the goal is to be able to maintain each of these positions for at least 10 seconds without loss of balance. That's what the CDC recommends for sort of an at-home test. I can tell you that from a clinician perspective and for how I train the people that I work with who are at fall risk, my goal is generally trying to hold each of these positions for at least 30 seconds and sometimes up to a minute. So what the physical therapy research shows is that 10 seconds likely isn't enough to get that full sort of motor learning effect that your body would need. So oftentimes when I'm training this with other people, I'm having them hold it for a substantially longer amount of time. However, from just a test perspective to see where your balance is at, 10 seconds is the goal. And for to have the most reduced fall risk, if you're able to complete all 4 conditions for at least 10 sessions, then that's sort of the top of the line. The fewer levels that you can make it to. If you can make it to only level 3 or level 2, your fall risk increases with the fewer levels that you're able to complete independently. The second test is going to assess sort of a combination of strength and balance. All you need is a standard dining room chair, so not a couch or something that's cushioned, and ideally one that does not have armrests because you're not going to be using your arms for this test. How this test is set up is you are sitting in a hard chair with your feet planted on the floor. You set a timer for 30 seconds and you stand up and sit down from the chair as many times in a row within that 30 seconds as you can without using your hands to push up and without losing your balance. What the literature shows is that the cutoff value for risk of falls versus no less risk of falls is 12 stands in 30 seconds. So gold standard for that is being able to complete 12 stands with no use of your hands and no loss of balance within that 30 seconds. So these are the two at-home tests that you can try just to sort of see where you may fall on the spectrum of fall risk. What I will also mention as I scroll down here, whoops, we'll slide this down a little bit. I have included a QR code here. So for those of you who like to use QR codes on your phone that you can scan with your camera app, this little QR code here is a video that I made going into a little bit more detail on these tests and giving you a visualization of what they would actually look like if you were to try them at home. So feel free to use that for sort of a refresher on those tests if you're interested. So getting through those tests, you've sort of compiled what your risk factors may be, as well as how you perform at a functional level with those two tests. At this point, making a plan to build your balance house is the next step. So how can you reduce your risk of falling? Number one, at the baseline level, this is the first thing I talk about with everyone, is try to eliminate as many of the sort of external factors that can increase your risk of falling. You can take the most athletic person in the world or the strongest, most fit, balanced person, and if you have them walk through their house in the dark and overthrow rugs, chances are somebody's going to trip and fall. So trying to eliminate those types of factors that can just intrinsically cause tripping hazards or falls, such as clutter on the ground or throw rugs on the ground. In the bathroom, trying to set yourself up for success with non-slip mats on the tub floor and on the ground, as well as grab bars to get in and out of the shower, are really key parts to navigating that more like slippery and unstable environment that bathrooms often can be. Adequate lighting. So especially for those who maybe have to get up in the middle of the night to go to the bathroom, or maybe you just wake up before the sun rises and that's when you generally like to get up, making sure that you have adequate lighting that you turn on that are easily accessible, or ideally night lights in hallways or in heavily trafficked areas at night can really reduce your risk of falls, because I think most of us have probably been in a situation where you have to palm against the wall, try to find your way to the bathroom in the dark, where that could simply be a lot easier if you just had a night light in the bathroom or in the hallway to the bathroom. And that lighting can be especially important for those of us who maybe have lower acuity of vision to begin with, or maybe cataracts, macular degeneration, any sort of eye conditions that can reduce your overall acuity of vision. Making sure that you get adequate light to your retinas so that your eyes can send that information to your brain is a big part of the puzzle. And then finally, handrails for stairs. You'd be surprised how many people, especially here in Pittsburgh, don't have handrails for either their external stairs to get to their front door or down to their basement. So making sure that you have something to grab onto in the event that you do lose your balance. If you're just scraping the walls and trying to hold on to something on the way down and you don't have a handrail, there's not going to be much to support your fall. So those are sort of the easy to do home modification changes that can be made to reduce fall risk in terms of environmental hazards. Working on to number 2 here, checking your vision. So like I mentioned with the lighting objective earlier, especially if you wear glasses at baseline or have any eye conditions that reduce your acuity of vision, making sure that you have regular eye appointments to make sure that your prescription is up to date and you have sort of the best equipment available to improve your vision is a really big component. Because if we're thinking of sort of that three-prong approach, vision, inner ear, and sensation, if there's one that can be modified or improved, let's absolutely do that so that your brain can get the most accurate information about where you are in space from your vision. Number 3 here is the key one and what a lot of my job entails, which is balance and strength training. So looking back at these objective tests that we talked through here, the nice thing about these is they not only give you an idea of what your function is, but oftentimes they turn right into the treatment as well. So say you're able to do levels 1 and 2 of the 4-stage balance stage test with no issue at all. And once you get to number 3, it's like you can't make it 2 or 3 seconds without having to step to the side or put your hand down. This is a perfect area to start working then, where maybe you start at number 2 and you try to hold it for 30 seconds or a full minute, apart from just the initial 10 seconds that you did. Once you get to that 30 seconds or full minute training at level 2 in the half tandem position, then maybe trying to go into like a 3/4 position. So you're not fully heel to toe, but you're a little bit past that number 2 position. Trying to work with that position up until 30 seconds, 60 seconds, until you can eventually get to the full tandem position. And then you do the same thing working from level 3 to 4. So starting in that full tandem position, trying to hold it for 30 to 60 seconds on either side. And then maybe you go to the point where you have 1 foot on the ground and just a toe touch on the other side, or 1 foot on the ground and you're lightly holding onto the countertop. And over time, you slowly start to take your hands away. So that 4-stage balance test is often something that when you find the level that you're working at, it's very easy to find sort of the next step to train towards. And what I want to emphasize too is in order to have an effect on your balance, you have to be working on what's difficult for you. If level 2 is no problem, you can do it without any issue, and level 3 is impossible, then working just at level 2 in 10-second holds where you feel like you're not losing your balance or even struggling at all is not going to give your body the challenge that it needs to improve your balance and your response to changes in your environment. So making sure that you are working at that level of challenge so that your body is being exposed to what it needs to sort of move into the next level of balance and stability. The same applies to the 30-second chair stand test. So let's say in your first trial, you're able to get 5 stands in 30 seconds. There's a couple ways that you can go about this. You can start with just trying to do that 5 stands for a couple rounds. So maybe you do 5 stands, take a 2-minute break, and then a second round of 5 stands. And that's where you start for the first day. And then slowly start to build up to 4 rounds of 5 stands, or sorry, 3 rounds of 5 stands, and then 4 rounds of 5 stands. And maybe at that point, you try to see if you can increase the number of stands that you do per set. So you're trying to do 4 rounds of 6 stands, 4 rounds of 7 stands, until you can get to that point where you can do 30 or 40 stands from the chair. Or maybe you start at the level where you can't do 1 stand from the chair without your hands. What you can do there is take some pillows or couch cushions and build them up on top of the chair so that it's a little higher to begin with, and see how many stands you can do from that height in 30 seconds and build a plan from there to help train at that level. And again, the goal of that one is to try to be able to do 12 stands in 30 seconds without using your hands. So with that one, either modifying the number of reps that you do or the height of the chair can make a very big difference in terms of challenging your body adequately. Another important part of the strength and balance training is maintaining your frequency of training. So with strengthening, often the sort of gold standard is 2 to 3 times a week of resistance training or strength training. However, there isn't a completely clear frequency or value that is out there in literature for how frequently we should be training our balance or our neuromuscular system to work on balance specific exercises. Anecdotally, this is something that often I'll try to have people do 5, 6, 7 times a week. The more exposure your body can get to these positions and trying to respond to changes in the environment, the quicker it's going to learn, and the more easily you're going to be able to progress through different levels of balance training. So the frequency of training is going to look a little bit different whether you're working on your balance exercises or your more strengthening based exercises, but both are critical to addressing the whole picture, because just working on one versus the other isn't going to get you to sort of that next level. And then bullet point C here is kind of reiterating what I was talking about in A, where you need to find that adequate level of challenge with the exercises. So if you're able to do it without feeling like you are struggling or feeling like you could lose your balance if you weren't working so hard, then you're likely not challenging your vision, your inner ear, and your sensory system enough for your brain to respond to it and strengthen from it. So that is really important to keep in mind, that working at a level that's very comfortable while it feels good is likely not going to give you the results that you want. And then bullet point D here, some really good supplements that are out there in research for what can be helpful in addition to strength and balance training can be Tai Chi and yoga. Both work on sort of the foundation of breath work, trying to ground yourself in different positions and shifting weight. So they can be very good adjuncts to balance and strength training programs to bring sort of more a conscious level to your balance and progress into some positions that you may not do on a day-to-day basis. Now, all of this all together is what is required to have an effect on somebody's balance system and build their balance house in order to improve their strength, their conditioning, and their balance system to reduce their risk of falls. But at the end of the day, I would never want somebody to be putting themselves in a position at home where they feel that they are unsafe or at a risk of falling when they're doing these exercises. So again, reiterating, do it near a countertop, do exercises in a corner where you have like a back to your wall behind you to lean against. Or if you have somebody at home at you or somebody that you trust, ask them to stand near you while you're doing that so that you have another set of eyes on you. Often something that I will also do that I'll just mention, it's a little bit more nuanced than what I'll explain here, but in order to further challenge your balance systems, those three elements, with each of these tests, the 4-stage balance test and the chair stand test, it becomes important to then challenge each individual system, your eyes, your inner ear, and your sensory system. And that can involve maybe doing some exercises with your eyes closed or trying to balance with your eyes closed, trying to do different exercises while moving your head side to side so that your inner ear and your vestibular system has to work more. Or maybe it's standing on a squishy surface to replicate what it's like outside in the grass after it's rained, like a day like today. So there's a lot of ways that this can sort of branch out from just this brief synopsis today. And everybody is their own sort of unique person with their own unique needs. So some person may be more reliant on one of those three systems than another and require different training than somebody who maybe presents in a different way. So all of that is to say you've got some things here to sort of check out and maybe start building a program for yourself. But finding something that you feel safe doing, that you enjoy doing, and that is adequately challenging is sort of the core sort of important part of building a program to build your balance house. And if all of this has felt overwhelming and like a lot of different things to think about, and you're not sure where to start, talk to your PCP, your primary care physician, or if you know a physical therapist that you know and trust, talk to them, and they can absolutely be a resource to get you on the right track of what's going to be most important for you. So that's all I have today for building your balance house. Again, at the bottom of this sheet, which I've provided to Corey and Kat, I have this link here so that you can see videos of those balance tests that we discussed, as well as my contact information here if any of you have any follow-up questions regarding what we talked about today. So I'll open up the floor now. If anybody has questions, anything they would like clarified, feel free to unmute or send anything into the chat box now.
I just wanted to mention, I did put the link that was attached to the QR code. So if anyone would like to follow that to YouTube, you should be able to access that and save the video if you'd like to watch it later.
Well, I do have a question. This might be outside of your wheelhouse, so if it is, just let me know. But I am curious, as someone who is moderately clumsy and falls, once or twice a year, is there a particular way people should try to fall, or are you really thinking more about avoiding falls entirely?
Yeah, that's a great question. So in terms of how to fall, oftentimes when you're in that scenario, it's hard to even really change the way that you are moving to react in time. Overall, trying to land on sort of the medius part of your body, your bum is often the best bet. But at the end of the day, your body's probably just going to reach out and try to catch yourself as quickly and best as it can. So really, I mean, there's no one way that's better than another. It's just that each way that you fall carries its own sort of inherent risks of what area is going to be more at risk. However, I will say for those who have maybe more cluttered homes or a lot of like sharp furniture, falling onto other objects while it's not as far of a drop to the ground often can have sort of more complications because it's more impacts and often a little bit like more of a sharp impact than hitting the ground. So ideally trying not to hit the way down would be something to consider.
Thank you.
You're welcome.
I wanted to share that I don't know if people know that there are underbed motion sensor lights that will give you, some light when you get up at night to help prevent falls then.
Yes, thank you so much for sharing that. I'm a huge fan of motion sensing lights. For those of you who have pets, it can get a little overstimulating at night. But overall, they're an awesome option so that you don't necessarily have to sleep with a lot of lights on in your room, but do have that adequate lighting when you need to get up in the middle of the night. Thank you so much for sharing that. All right. Well, if there are no other questions, again, my contact. Oh, do you have one, Debbie? Oh, is there something in the?
Yeah. Debbie, if you'd like to unmute yourself, look for the microphone button beneath the screens, and that should let you turn your mic back on. But if you're not seeing that microphone icon, you can always type a question into the chat. Any luck, Debbie? Maybe a thumbs up or a thumbs down?
It looks like she might be typing.
Debbie, can you just give us a wave real quick if you're typing something? Okay, she is definitely typing something.
Yeah.
And hopefully we should have these up. I will. I'm not sure if I have your email, Debbie. I'm gonna put mine in the chat just in case. But if I have yours already from a prior program, I will send it to you. Hopefully we should have a recording up either sometime this week or maybe early next week. And yeah, we can also include the handout for anyone who'd like it. Are there any other questions anybody has before we wrap up?